Hello, I'm Maggie Hansen. I am the Senior Vice President, Chief Nurse Executive for the Memorial Healthcare System. I have been a direct report for Nina for the past 4 years. However, I've had a vast career in the Memorial Healthcare System, holding numerous positions as a Chief Nursing Officer for the past 16 years. Throughout this time, I have developed a great understanding of Nina Beauchesne's vision, her operational oversight, her impeccable professional standards, her business acumen, and her collaborative communication skills. Nina has an amazing track record of promoting gender equity in the C-suite. It was something less common prior to her arrival. In fact, she actually was the first female administrator within our system. In that role, she grew a small pediatric service line to a 127-bed children's hospital between 1995 and 2003. Since then, she has overseen the opening of the first standalone 180,000 square foot children's hospital in our county with 226 beds in 2011 and currently overseeing a $160 million 4-story expansion inclusive of an intraoperative MRI. Nina was also the first female administrator to join the C-suite, and then for 10 years, she was the only woman on the system's executive team. Throughout her career, Nina has been known as a talented trailblazer, and she has paved the way for numerous female leaders within our organization. She has always been cognizant of identifying, nurturing, and cultivating female leaders. She has been an exceptional role model for many, even going as far as providing one-on-one mentoring for women leaders throughout the system. She has created a culture that attracts, develops, and retains high-quality professionals who want to follow her, who want to, not because they have to. As a Chief Nurse Executive, I have never experienced clinical support for the front line as I have with Nina Beauchesne. Although she is not a nurse herself, she can quickly evaluate challenges for nurses practicing at the top of her license and assist in removing those challenges. As a result, the nursing outcomes in the Memorial Healthcare System are stellar, and for that, I am extremely grateful. Thank you.
Hi, my name is Melida Katie. I'm the Vice President for Ambulatory and Community Services for Memorial Healthcare System. I've been under Nina's direct report for over 7 years, and I have been with Memorial for 11 years. I oversee 10 primary care centers, multi-ethnic group, multicultural, and also 2 urgent care and an adult daycare. It's interesting, as I started my relationship with Nina, I had a very, very candid conversation with her. Our journey began by me informing her that she needed to understand how racially charged it is for an executive female. And the fact is that she had to spend more time and understand my role in the organization because of us serving basically an executive team of white males. And she was very, she understood immediately. And that's something that really I admire about her. And she never, ever has allowed me to forget that she understands how important it is for her to be able to not only supervise a Black female of Hispanic origin and foreign-born. And she understood that that weighed a lot more than supervising my counterparts. In our role, what we have done is that we have been, she has allowed me and she has mentored me in allowing me to have my voice. But my voice prior to Nina was one that was shattered every glass in the room, because at times I felt I had to be so forceful to make my voice be heard. And Nina allowed me to have that voice and not lose my identity, but be able to do it in a way where I wasn't shattering rooms. and I was able to get the resources I needed to be able to be successful. And let us talk about the success that I have been able to accomplish because of Nina's mentorship. When I started Memorial, there was, in 2011, we had a $21.2 million loss. And now, in 2020, we have only a $7 million loss. Remember, we serve the uninsured. So in that mix, we have not only uninsured, but we have changed the payer mix to Medicaid, Medicare, commercial, and the Affordable Care Act. We have brought in over $9 million insurance savings from Florida Blue, and we have increased the encounters by 30%. That is an accomplishment because of Nina's mentorship. And she has also allowed me to do my passion. My passion is the community. And my passion is to serve the community, and so we have such a diverse community, over 25 countries represented in our community. And so I serve on many boards that has to do with our children in foster care. As you know, 80% of children in foster care are Black and brown children. And I serve on homeless boards. I serve, and all those boards allow me to be able to do my passion. And Nina has never, ever, there has never been a conflict in regards to what I need to do for the community and my job here at Memorial. Nina, because of her mentorship, this organization is stronger and has ensured that the local residents are receiving the care that they need to receive. Because we have been able to be comprehensive. There has never, ever been a bottom line. Melita, we cannot do this because of the bottom line. She has allowed me and this organization to thrive because of how she loves her community and how she understands her community. And one of the things is that Nina not only is, what I find beautiful about her is that we all know her by Nina. I don't know if anyone, not only because her last name is very difficult to pronounce, but everybody, she makes everybody feel so comfortable about her role as Nina. And one of the beauty of it is that people that are not under her supervision look up to her, especially young female coming up and coming, they look up to her and they say, well, if Nina can do it, I can do it. That is a trailblazer. That is a multiplier. She allows women to see her as that person that they can become, a senior executive in a male-dominant environment. But last but not least, I want to share a little story. Remember, I started by sharing with you my journey with Nina on racial equity or inequality in healthcare, and how I was very candid with her, and I told her that, hey, you're going to have a heavy job supervising this woman. And she was very accepting and understood. This year, she and I were talking because it wasn't a one-time conversation. It has been an ongoing conversation because the journey of a Black executive woman is not a one-time journey. It's a journey. It's a lifetime. And one of the things that Nina, we shared this year, she said to me, there's a program on TV, and this white couple adopted this Black child. And the father said, oh, I'm colorblind, told his son. And the son said, if you are colorblind, that means you're not seeing me. Many times, we kind of disguise ourselves by saying we are colorblind, but we are not colorblind. And that moment, I knew Nina got it, because she was able to transcend and said, no, we are not colorblind. We have to see color, race, and inequality in everything that we do. So I'm excited about her having this opportunity because she deserves it. She is a real healthcare executive that looks at women and minority women as her job to bring them up. Thank you so much.